The first time I had lymphoma was in 2006 to 2007. In 2015, I started feeling just tired. I wasn't myself. My mind wasn't quite right, and I would go to work and I'd come home in the afternoon and just feel exhausted. I could hardly even make dinner. So something wasn't right. And so I went to the doctor. I went to Dr. Kiley at Morrisville Family Health. So Dr. Kiley decided I should have a CT scan with a tracer, and so I did, and I had that done at Copley Hospital. And Dr. Kiley brought me back into the office and said he was sorry to inform me, but he really thought it was lymphoma again, and really encouraged me to seek oncology care as soon as possible. At that time, I did not have health insurance because I was only 6 months away from receiving Medicare, and so all these tests were going on and we were paying out of pocket. And it became kind of too burdensome for our financial situation.
Lani works as an artist and cleans homes. Charles is a retired painting contractor. Battling cancer for the second time with no insurance and few assets, the medical bills were overwhelming. Lani called Copley's Patient Financial Services for help signing up for insurance through Vermont Health Connect. She also learned about financial assistance offered through the hospital's Charitable Care program.
I went to Copley Hospital and I met Angela Griggs, who was the financial counselor at the hospital. And she was just absolutely wonderful. She took me in right away. We had a little interview. I explained our situation. And she said, well, we have to get on this. And so I went home, filled out some paperwork right away, came back right away the next day. Angela said, you should apply for financial assistance. And so I said, okay, I don't really want to do that because we've never had to do that. But at that point, we had to do something, and she was so sweet, and she did not make me feel bad about it. She didn't make me feel unworthy of it. She said, really, Alana, you've worked all your life, and these things happen, so we want to be able to reach out and help you.
We found the financial assistance at Copley enabled us to take that burden off of us, and both of us were just allowed to just get better. We had the comfort of just, it takes time, it takes treatment, it takes asking questions, it takes receiving help, it takes receiving the help, sometimes in uncomfortable situations, but it allowed us to just get better.
Both of us were so grateful, and I think part of really getting better when you're sick, like as sick as I was, is you have to have the right attitude. You have to be honest about your situation, and you will get through it and you will survive, but you have to make that decision that you want to live. I'm so grateful for the community's support. I think that the fundraising that is being done for Copley Hospital, the past fundraising that people have been a part of has been critical to the ongoing nature of this program for people. And it just takes a few people doing a few things that really make a difference. Now I am completely what I consider healed. I'm completely better, and I have to go in every 6 months now. I was going for 3 months checkups, now I'm going for 6 months checkup. So I'm over the hurdle. To have local support is so important for people, and it was just, Copley was just a huge partner in that with us. So we have a lot of gratitude about that, gratefulness, and we will never forget it.